coordinated care is all about communication and daily service planning for these high-risk patients.
Well, healthcare is changing. Instead of primary care looking just at the medical needs and behavioral health looking just at the psychiatric needs, we're all working together to look at the patient more holistic.
Well, Tammy was a woman who has really severe liver disease, and because of that, she would recurrently have problems with fluid building up in her belly.
Right away, we recognized there was a need for her. She had a lot of emergency room visits because she was having so much pain from her condition.
It was just one thing after another and then she fell, broke her leg, couldn't walk, in the wheelchair.
I had a blood clot go to the lung. I got diabetes really bad where I had to take insulin. And then some liver problems came up. And then kidney problems came up.
She was basically going to the emergency room every 3 or 4 days. So we had to figure out something that would allow her to function without making these recurrent trips, which is very hard on her because she was quite ill.
Tammy's situation, I think, was really about developing a plan. Like, what are we going to do when this happens?
So we decided we were going to have a family meeting and develop a care plan for her. Lindsay came in, the inpatient provider, the hospitalist came in, and we just talked about what was important to Tammy.
And for Tammy, reiterating to her that this is how you stay out of the hospital. This is how you spend more time with your daughter.
I think getting all the doctors together, which is what she had done, and us get on the same page so we all knew what kind of medications I was on, helped a lot.
She would call me, say that I'm having the ascites back, the fluid's building up, I need to have another paracentesis. I would get a hold of Lori.
It was very depressing for her, and she really didn't have any motivation to want to get better if she couldn't be home with her daughter. So we just sat down to see what was important to her and how do we motivate her based upon what her goals are. And I think that's truly why I was effective for Tammy.
I think with them all working together, I went from 14 medications down to, I think, 6.
And you just see, like, in Tammy's situation, how much better it is for her daughter, how much better it is for her life, that, like, what you do is making a difference.
It was just nice to see the turnaround in Tammy, when everything was set up for her. Psychologically, she's tremendously better. And physiologically, she's much better. There's no question about that.
Being able to play with my daughter at the park, because I haven't been able to do that in the last couple of years. This is the best I've felt in over 5 years. He says I'm his old Tammy again.